the topic allotted to me for today's Viagra Night is migraine patients and phosphodiesterase inhibitors. So I think a lot has been explained about phosphodiesterase inhibitors. I'll just highlight about the few slides about the migraine. As we all know, migraine is a primary episodic headache disorder that is characterized by various combinations of neurological, gastroenterological, and autonomic changes. Approximately 1/3 of the migraine patients they present with aura, and 3/4 of the patients they experience a premonitory phase prior to the onset of the headache. Migraine is a widespread and it can have a substantial burden of illness. The 1-year period prevalence is 18% in the women and 6% in the men. That shows that migraine is 3 times more likely common in females than male, and the peak age of prevalence is 30 to 55 years. So now I'll highlight how migraine works. Basically, migraine originates from the deep white matter deep within the brain, and there are electrical impulses that spreads to various other regions of the brain, and that causes changes in the nerve cell activity and blood flow, and that result in the visual disturbances, numbness, tingling, and dizziness. There are also chemical changes in the brain, and that causes blood vessel dilatation and inflammation of the surrounding tissue. And if many times there is inflamed brain parenchyma where branches of trigeminal nerves are there, so that result in the severe throbbing pain. Now I have framed few questions regarding the phosphodiesterase inhibitors and migraine. Then the first question is, what is the risk of phosphodiesterase inhibitors triggering migraines? The next question is, does the risk vary among the 3 medications like sildenafil, vardenafil, and tadalafil? Is the risk dose related? Does the long duration agents like tadalafil causes long duration migraine? Do phosphodiesterase inhibitors trigger migraines respond to the patient's usual acute migraine medications? Or how might phosphodiesterase inhibitors causes migraine? So I'll cover each questions in a single slide. So there is the side effects of profile for all the phosphodiesterase inhibitors are almost identical, and that is headache. That is being the most common side effect, and that is dose dependent. So recently, 2 studies were performed investigating the effect of sildenafil on headache, cerebral blood flow, and arterial dilatation. Out of these 2 studies, 1 study was performed in the healthy subjects and the other in a patient with migraine without aura. In first study, out of 10 healthy subjects, in which 6 was men and 4 were women, and almost 10 reported headache, and 3 of these fulfilled the criteria for 1 attack of migraine without aura, despite they have no previous history of migraine and no first degree relatives with the migraine. It means these patients were never have had any episodes of headache in the past, and after taking these medicines, they have developed the migraine attack. In another study, out of 12 migraine patients, 10 reported induction of migraine attack similar to their usual migraine attack after ingestion of the sildenafil. So coming to the first question, is there a risk of phosphodiesterase inhibitor triggering migraine? Yes, definitely there is a risk that phosphodiesterase may trigger migraine or may cause cluster headache or headache. So 80% of the migraine sufferers are likely to get an attack of migraine after the use of sildenafil at a therapeutic dose. The risk is now the other question, does the risk vary among 3 medications like sildenafil, vardenafil, and tadalafil? Yes, the risk is definitely varied in all these three medications, which are most commonly and most widely available. So tadalafil has the longest half-life. It could induce longer lasting migraine or an increased risk of recurrent migraine. The risk is definitely dose related, even at the optimal dose. If in case of sildenafil, if you give the optimal dose of sildenafil, even though there are chances of headache or attack of migraine, so definitely the migraine episode may occur with the increase the dose. So we should be very cautious while prescribing any phosphodiesterase inhibitors in a patients of headache or in a patients having history of migraine. Do phosphodiesterase inhibitors triggered migraine respond to the patient? Yes, definitely these patients respond to the usual dose of the medications which are used in the acute migraine, like sumatriptan. So in the conclusion, I have given only a brief about it must be recommended that the labeling of these drugs include a warning to the migraine patients. While prescribing phosphodiesterase inhibitors, we must ensure and explain to the patients if they have the history of migraine, then definitely there are chances of recurrence. There are the frequency may increase. So migraine patients should be made aware of the risk of inducing a migraine attack before initiating the treatment with the phosphodiesterase inhibitors. And the most short-lasting phosphodiesterase inhibitor like vardenafil or sildenafil in the lowest dose should be used first. So these two are the preferred in a lowest dose. Okay. Thank you for the patient listening.